Of hospitals once again feeling the strain as COVID cases continue to go up because of the Omicron variant, staffing shortages, burnout, and much more. Medical professionals are asking all of us to do our part. So here with me now to discuss this further is Chief Medical Officer of Integris, Dr. Julie Watson. Welcome to the show, Dr. Watson.
Thank you.
First, I just want to start off with some of these latest numbers. I mean, I know it fluctuates day to day, but overall, paint me a picture of just how full our hospitals are.
Our hospitals are at capacity without question. I think there's difficulty depending on which report you look at because of federal guidelines and definitions. Some of the HHS data shows that we still have 10, 13% capacity, but I can tell you that those reports require us to report our OB beds, our women's beds, our children's beds, our nursery beds. But when it comes down to it, there are no ICU adult beds. There are no med-surg adult beds really in the city. It is a one in, one out, and we continue to have ED holds that are substantial.
And yesterday, a big meeting, of course, with healthcare professionals across the state. You described the hospitals as sometimes feeling like a war zone. I mean, can you elaborate on that a little bit for people who may have missed yesterday's meeting?
Absolutely. And this is not an effort to use scare tactics. This is really to show the community, to tell the community that we really are in dire straits and we have to buckle down until this surge is over, until we're on the other side. But at the end of last week, we, as Integris Health, we were caring for patients in hallways. We had patients on stretcher beds in our hallways. We're having to intubate patients in closet rooms. That's what makes it feel like a war zone. That's the reality we face. It can, some days for a few hours, it can be more like what you're used to experiencing. And then there are hours and days on end where it's nothing that we're used to.
And a lot of people say, and we've heard this too from a lot of medical professionals, that Omicron cases can be very mild, and a lot of them are. So I guess the question is then, who exactly is ending up in the hospital at this point?
So who we're seeing in the hospital still are the unvaccinated for COVID. So we took care of patients with diabetes and heart attacks and all of that before. That's our usual volume. And frankly, hospitals aren't in the business of just having lots of staff around doing nothing. So we always run very close to capacity because we have to be good stewards of our resources and our workforce. So we are still admitting 75% of our COVID patients are unvaccinated. And so when you think about it, if everyone were vaccinated, we'd have a very small proportion of the public that we're admitting for this particular disease. And we could probably handle that margin on top of the normal work that we typically do. And tragically, we're seeing our elderly who've done everything they should, everything they can to be vaccinated and boosted. And we are admitting them as well as our immunocompromised patients who are vaccinated. They often go home in 3 or 4 days, thankfully, but it's our elderly that I am very concerned about.
Another issue we've heard for hospitals is people showing up for maybe mild symptoms or not really needing to be admitted, or even COVID tests. So is that still an issue at this point with our hospitals?
I believe that is getting better. I think all of our hospitals banded together in the metro to try to reinforce on social media, please only use the ER for emergency services. I do feel like we're starting to see that get a little better. Our public-private partnerships with Emmy Labs and the state, several of us in the metro have an Emmy Lab testing location now, either on our campus or very close to an ER or a major facility. That has been a godsend, and it feels like people are starting to get that message. So thank you.
We also did report, our lowest case numbers since January 3rd yesterday. I mean, still thousands, but a lowest number that we've seen in a bit. Is that a trend that you think we may continue to see here? Have we hit our peak?
I hope that trend continues. We are cautious to go there right now. We know that Tuesday numbers are typically lower than other days of the week. I think we'll learn a lot today. Keep in mind, though, even though case counts start to go down, hospitalizations lag at least typically a week, sometimes 2. So even as cases start to go down, we still feel it for the next 7 to 14 days. So we don't get much relief right away.
And Dr. Watson, last question here. I mean, what's your final message for people listening today? What's your biggest concern at this point? Kind of parting words here for people.
We we want to treat you. We want you to come to us for care. We're going to ask for patience and grace. We are working under extenuating circumstances, and our workforce is battered. So we just need to band together. I also would encourage you, if you've not gotten boosted, please get boosted, and don't give up on conversations about the vaccine. For me, this is a public health issue. If I could go on forever, but please get boosted, please get vaccinated, and let's treat each other kindly.
Okay, Dr. Watson, just thank you so much for all that you are doing and the rest of your staff and healthcare workers. We know how hard you're working, and we just appreciate you coming on and giving these messages to our viewers.
Thank you so much for having me.
You're welcome.